All right. What does the case fatality rate measure? The case fatality rate measures how many people with a particular condition will die. Can the West Nile virus cause a strange sort of weakness in a patient? Yes, it can. How do you treat pneumocystis pneumonia in an immunocompromised patient? TMP sulfamethoxazole. How do you calculate the absolute risk reduction? It's a case number minus the expected number. Recurrent pneumonia in a smoker is a common finding seen with what sort of cancer? With bronchogenic carcinoma, right? They tend to get recurrent pneumonia. What's the best test to diagnose an endobronchial obstruction? Flexible bronchoscopy is. What sort of study method requires pulling data from several studies? That would be a meta-analysis. Note that psychogenic erectile dysfunction, with that, their symptoms may involve complex thoughts and psychology responsible for this psychogenic erectile dysfunction. Are people with latent TB able to work? Yeah, they are. If you don't like your patient and they're so rowdy and just obnoxious, is it okay to abandon them? To just be like, I don't want to see you anymore, don't come to my office? No, it is not. You need to transfer their care, despite how salty they are, just transfer their care to someone who can deal with them, but don't just abandon them. What sort of condition is commonly experienced by young children that involves a non-REM arousal disorder? A sleep terror, right? Sleep terrors are non-REM. With regards to getting your patient information for a procedure, always be open and honest about them. And always be open and honest about studies and side effects and contraindications and risks and benefits. It's only going to be helpful for everyone. What sort of studies are good to study outbreaks? Case control studies are good to study outbreaks. What sort of diuretics are good for treating hypoparathyroidism? Thiazide diuretics are good for treating hypoparathyroidism. A high protein diet is good regarding what syndrome that happens status post gastrectomy? Dumping syndrome. High protein diet is good to treat dumping syndrome. Abdominal pain out of proportion to exam is concerning for what sort of ischemia? Acute mesenteric ischemia. So in that case, an abdominal CT angiography is good to get the diagnosis. Is Eryslapilis a group A streptococcus? Yes, Eryslapilis is a group A streptococcus. For a patient with dyspepsia, what sort of testing should you get that's for a common organism seen at GI biopsies? H. pylori. What oral medication is used to treat lactational mastitis? Oral dicloxacillin is used to treat lactational mastitis. If a person specialized in latching techniques comes to see your patient and is like, I can help with the lactational mastitis, is that a good thing or a bad thing? It's definitely a good thing because those individuals are specialized in treating all sorts of latching issues, including lactational mastitis, right? If it is getting worse, you can do an ultrasound and a breast ultrasound to check for an abscess if you think the lactational mastitis is forming one. For a patient with laryngotracheitis or croup, what do you want administered? Intramuscular corticosteroids, right? Yep. If you have a type 1 diabetic patient, what do you want to do regarding their medication regimen prior to them starting an exercise? Want them to have a lower insulin dose before that, right? Also, if you're in your gynecologic clinic and a patient comes in with cervical insufficiency, you need to be aware that the baby can fall out, right? Get that cerclage. Even then, is the prognosis of pregnancy poor if they get a cerclage placement? Yep, prognosis of pregnancy is poor. In an emergent situation where you need an anticoagulant, should you use warfarin or IV heparin? Use the IV heparin. True or false? Patients with hypocalciuric hypercalcemia need abundant screening and many medications. False. Those individuals usually lead long, healthy lives and don't need medications, but do follow up. What medication is used to treat HELLP syndrome? Magnesium sulfate is used to treat HELLP syndrome. What is the best way to prevent osteoporosis? Exercise, vitamin D, and calcium. What is the number needed to treat? How is that calculated? It's calculated as 1 over absolute risk reduction. Maternal alloimmunization may result from failure to adjust dose of anti-D immune globulin after a massive fetal maternal hemorrhage, right? What sort of test can check for fetal maternal hemorrhage, bloods crossing over? Is it like the Kleinhauer-Betke test, something like that? Note that perinatal hepatitis B infection should be treated with hepatitis B immunoglobulin within what time frame? Within 12 hours of delivery. Can twins be delivered vaginally? Yes. Is an ectopic pregnancy a non-emergent issue? No. Ectopic pregnancy is emergent and you need to treat it as such. What sort of GI condition results in watery diarrhea and emesis and is usually treated with a good diet with low fat and a low sugar content? Viral gastroenteritis. What does the CHA2DS2-VASc score tell you? It tells you the thrombotic risk in patients with atrial fibrillation. And you would treat with an antithrombotic if the CHA2DS2-VASc score is greater than or equal to what? 2. What is the treatment for a uterine sarcoma? In general, it is a hysterectomy. And then you're talking about some correlation coefficients, right? So I'm going to say the correlation coefficient, and you tell me if it's strongly correlated or strongly inversely correlated. So 0. Aha, trick question. No relation. What about positive 1? Strong proportional correlation. And what about 1 inversely proportional would be less than negative 1, right? So negative 1 is strong inversely correlated. Do patients have autonomy about end-of-life care if they have clarity of thinking for the most part? Yeah, definitely. All right, so tell me what this kid has. It's a kid with sexual characteristics. They're below 8 or 9 years old, male, female, whatever, with increased LH, FSH, and advanced bone age. What do they have? central precocious puberty. Again, that's a kid with sexual characteristics less than 8 for boy, less than 9 for female, with increased LH and FSH and advanced bone age. All right.